Assalamu alaikum. Peace be with you. This is Imam Malik Mujahid, and you are watching Mujahid Talks on Muslim Network Television. And we are there every day, 24/7. And you can always watch us on Galaxy 19 satellite, Amazon Fire TV, and also on our own website, muslimnetwork.tv. Today, we'll be talking about something which all of us are worried about, and that is coronavirus. But in different places, it demonstrates it has a different impact. Right now, there are in Yemen, which has a civil war going on for a while. Unfortunately, proxy war between Iran and Saudi Arabia as well. A lot of devastation. And in the midst of that devastation, there is this coronavirus. And Obad, a grave digger, says that he's digging more graves than ever. So it's a hot country, difficult situation, but lot of problem. In Rohingya refugees, there are 15,000 Rohingya refugees who have been isolated for quarantine purposes because they tested positive. But they are very close. I mean, I have been to those camps. They are well next to each other. Impossible, impossible to maintain any physical distance whatsoever, because I have been in those camps. My office actually was in the midst of those camps, and people are just next to each other. In one 10 by 8 space, there will be 8 people living, and they come out, and just there is a foot and a half. That's it before another tent begins, unless it is already adjacent to that. So in different places, there are different type of manifestation. Today, we will be talking about Pakistan and coronavirus. My curiosity started by a simple fact. I called my brother to offer my Eid greetings, and he has gone to a graveyard to offer, some prayers for my father who's buried there. And he's a social type of a person. So he started talking to gravedigger there, and he said, "Well, our business is down." He said, "Why?" He said, "Well, before coronavirus, before pandemic, we used to have 30, 35 dead bodies which we'll have to bury in a day. Now there are just 2 or 3." That I was shocked. Then I looked up at the statistics. Pakistan is the 5th largest country in the world when it comes to population. It has more than 212 million people, as compared to the state of Illinois in the United States, which has population of just 13 million people, and it has 5,000 plus death. Pakistan has only 1,700, Pakistan has only 1,200 deaths so far, which is many fold bigger than Illinois. United States have one case among 192 people, on one death among 3,000 cases. And in Pakistan, there is a one death for about more than 160,000 people. So I was curious, what is the Pakistani drinking? Or is it in their air? Why a place where there is not much social distancing being offered? People have been worshipping and praying in the Ramadan and hugging and kissing and bustling bazaar and marketplaces. We were worried, and we're still worried. But how come the death rate is so low? So that curiosity took me to different people, and I started talking about it. And one of the person I found was quite curious about that was Dr. Mansoor Ahmed. Dr. Mansoor Ahmed is a community leader in Cleveland. And welcome to Muslim Network, Dr. Mansoor Ahmed.
Thank you for having me over here, Mujahid Saab.
And he's a graduate of the King Edward Medical College in Pakistan, and he has done postgraduate education at McGill, and he has done fellowship of respiratory medicine and critical care at the University of Toronto Health Services Center, as well as in Winnipeg, and serves as a faculty of medicine and international health at Case Western Reserve University, Cleveland. And he's an attending and teaching faculty at for ICU and respiratory at Metro Health Medical Center. He's currently CEO and principal investigator and researcher at Cleveland Sleep Research Center, and is founding member and medical director of Cleveland Ibn Sina Free Clinic. Uh, Dr. Mansoor, you were among the first people who raised this question. And when we were talking about what is going on, that, concern about Pakistan. So, what are your initial thoughts about what is happening in Pakistan? It is far lower cases of death. I mean, I has anecdotal evidence from my brother who talked to the people in graveyard. And statistics are also saying, initially I thought, well, Pakistan doesn't have a good statistics collection system, so there may be many more deaths. But it seems there is a lower level of deaths, and which is happy, which is good. I like to have lower level of deaths in America as well. Is there anything America need to learn from Pakistan?
Yeah, thank you, Mujahid Sahib. This is a relatively new virus. There are cousins of this coronavirus, which have been there for a long time, which cause common cold. They have been here for years, as you know. Many of us get the common cold, and they're caused by the coronavirus. I call them the cousins of the existing coronavirus. And this one is a relatively a new species of coronavirus, and it only came into existence since December from China. The first cases, as you know very well, they originated in Wuhan, and we are learning still. I think how does it spread? Why some people get very bad infection? Why some people are spared? Then there are a whole bunch of I think that the concerns that why it is affecting the here in the United States, why Afro American community, Hispanic communities are more vulnerable, people with underlying medical conditions. So that individual vulnerability, it's not clear at all. I think why I think there's a sort of course, when you have a predisposition condition such as diabetes, chronic obstructive lung disease, obesity as well, I think you can make a case because of the underlying compromised status of human physiology. Any infection can create the havoc. If somebody get the pneumonia, a young person get pneumonia versus a person who already have a chronic obstructive lung disease, it will have a more devastating effect. But there's much more beyond that one. We don't understand yet, okay, what are the genetic variabilities which makes people more susceptible to get the serious disease. We are learning. So first of all, we have to be very humble at what we interpret, what we say over here. It changes, I think, on a day-to-day, on month-to-month basis. It's a 4 months is a very short time to understand the disease. And that's very, very obvious. I think what is happening now.
So, are you implying that the virus strain in Pakistan might be different than the viral strain in America, which is killing more
So
people?
that is okay. So now we are talking about over here what we call the case fatality. How many people were diagnosed to have a coronavirus positive, and how many of those cases basically actually die is called the case fatality, not the mortality rate, but the case fatality. That we have 100 people diagnosed to have a COVID viral infection, then how many of those people died called the case fatality. And no matter however you analyze it, the number of people who are dying of coronavirus, for example, we have a 60,000, 60,000 plus people in Pakistan, and the known death, these are the known cases. And out of that, only 1,200 people died. And as compared to other countries, I think the case fatality rates is much higher in the United States and in Europe. Why is that? I think it is really, I think it's speculative at this stage. Uh, they for sure that the we have to look at the age groups that which is there a difference between the age group, which is the common denominator, if the elderly are much more susceptible to die of the disease as compared to the young people.
And
uh,
of course, in Pakistan
the
has
population is very high
high level of younger population. So let me bring in Dr. Abdul Bari Khan. Dr. Abdul Bari Khan is a cardiac surgeon by profession, and he has been doing an amazing job. A founder of Pakistan's first zero cost hospital. When I visited, I noticed sign all over the hospital. If anybody asks you for money, call this number. So they're keeping an eye, policing that nobody asks for any payment or any fees. So he has a career which reflects his love for medicine, an unwavering sense of community. He is he Dr. Khan is instrumental in establishing the hospital and now leads its 150 bed facility, and now co-founder of a network which has 12 hospitals and 25 primary care centers for preventive services team across the country. It provides care to 300,000 patients every month, I'm assuming free of charge. He's honored by Pakistan with its highest civilian award, Hilal-e-Imtiyaz. There's a crescent of distinction. And he was recognized by the United States as Eisenhower Fellow, and he's a member of Pakistan's Prime Minister's National Task Force on Health. Welcome to Muslim Network, Dr. Abdul Bari Khan. Assalamu alaikum.
Walaikum assalam. Thank you for having me on this network. And I was listening to Dr. Mansoor Ahmed to his talk, and you were talking about the prevalence and the severity of disease in Pakistan.
Yes,
so,
the question which I raised was that we're in the state of Illinois, which has only 11 million people, but it has 5 times the depth of Pakistan. So we have more medical facilities than Pakistan does. So the questions, and it started off by me calling my friend, my brother, who was visiting, father's grave to offer dua. And he spoke to Gorkun, or the grave digger, and he says, well, we have, we used to have 30, 35 people brought in for burial. Now we have only 2-3 people. So we are curious that this doesn't look like a statistical problem. It looks like a phenomena. So we want to understand that. But I'd like to thank the Pakistani's Physician Society of Chicago, especially its leader, Dr. Nadeem, who arranged for you, and you're honoring us with your presence. No. May God bless you. All the work which you're taking care of poor people. Taking care of poor people is so critical in our society. Majority of the people who are dying in Illinois are African American and Latino poor people. So you taking care of that. So please reflect on these issues for us.
So basically, as Dr. Mansoor said, we were also curious that the severity of disease is not as bad as it is in North America or Europe. So, but we do have numbers, but the deaths and patient going to ventilator are not as much as. And the only thing which comes to our mind is the younger Pakistani population. So, out of 1,200 deaths, more than 1,200 deaths, about 70% are more than about 50 years of age. So mostly in 80s, 70s, and 60s. So very few are younger age group, and those are the ones who basically neglected and didn't come to the hospital earlier. So the only explanation which Dr. Mansoor also said, and which we also think, is the younger population which we have. So there is no other explanation. But the severity is less, but the contingency is spreading very fast. After exponential growth, we have seen from the start. The first patient was in 26th of February, and in first 1.5 months we have about 4,000 cases, 4,500, and then when we ease out the lockdown, it went exponential growth, and within 5 days it was double. So now it is doubling, and you can for after just from when it was further eased down, the lockdown was eased down, and the Eid and the Juma prayers were open. People came out as they have not been to the market for 2 months, so you can see the rush in the market. So now the numbers are into three figures. So for last 1 week we are more than 1,000 people. Yes, last 24 hours we have more than 2,000 now. So now we're expecting by 15th of June, the numbers will be more than 75 or 80,000.
So you're worried that it is now in that mode of doubling and tripling?
Yes, and actually, to have a lockdown in our country was not because we want to. What we wanted to do is to slow down the spread of the disease, because, as you all know, the healthcare infrastructure is fragile in Pakistan. So we could cope up with people coming in ones or twos or 10 or 20s, but now not in thousands. So people here say the healthcare workers are the front line. I tell the people that no, the community is the front line. We are the last line of defense, and people have to behave. They have to have, unless you have self lockdown. No lockdown by the state cannot prevent you from coming out of, unless you are convinced, you are disciplined yourself, that can prevent. So once the front line is broken, then all the load will come to the last line of defense, which is health workers. And if, God forbid, that last line of defense breaks, then it's a chaos.
Thank you, Dr. Bari Khan. And you're watching Muslim Network Television. This is the first American Muslim television. You can always watch us on Galaxy 19 satellite and Amazon Fire TV, as well as our own website, muslimnetwork.tv. And we'll be right back after these messages. Welcome back to Mujahid Talk. You're watching Muslim Network Television. We're on Galaxy 19 satellite as well as Amazon Fire TV, and this week, hopefully on Apple TV as well. We are discussing different aspect of pandemic impact in different countries. We talked about Yemen. There are more graves being dug, and we're talking about Pakistan, where less graves are being dug, and Rohingya camps and refugee situation, where physical distance is almost impossible. So question which we raised was, how come Pakistan has 1/5 of the death as state of Illinois in United States, while the population, of course, 11 million, 13 million in Illinois, and Pakistan is the fifth most populous country with the less infrastructure for medicine. So one of the things which a scholar at the University of Illinois shared with me, he was saying that coronavirus COVID-19 has different strains. And one of the strain which is found in Pakistan and South Asia in general is a weaker type of a strain. Is there some research in Pakistan on this particular topic? Are they studying what type of formulation this virus has?
You asked. Sorry, go ahead.
Not really. Not really. There was some claim by someone that there is a different strain, but I don't think so. Okay, there is any such research which can tell you that there is a different strain.
So, since you have a whole lot of facilities, about 12 hospitals, so which I didn't know. I thought there is only one Indus hospital, for which I raised money in Chicago, and I visited and was very happy and took a photo of the sign. If somebody asks you money, call this number. So you had 12 hospitals and 25 primary care. How many of these hospitals and primary care units have capacity and somewhat of a training how to handle a coronavirus patient?
Basically, we have been instrumental from day one. When the first case was established on 26th of February, on 27th of February, there was an urgent meeting by the Chief Minister of Sindh where I was invited. And since then, we have been on the front line and collaborating with the government because the government asked us to do procurement on their behalf because their processes are lengthy. We can do it. And in a week's time, we established two hospitals. One in 100 bedded, another one was 150 bedded hospital, which was the building was there. We equipped it, got the ventilators. We started the first lab, PCR lab, and now out of 12 hospital, my main Karachi hospital is the main frontline. We have the largest PCR lab. It does about 1,000, 1,200 cases tests per day. Then we have a large unit of about 40 bedded COVID unit where patients are with 15 bedded ventilatory capacity. Then we have the Muzaffargarh hospital has been declared as a COVID hospital, which is a 400 bedded hospital. Then our public health global health delivery directorate is being involved, going into the community, working with the government for collecting samples from the community and bringing it to the labs in the region, across province of Sindh and some part of Punjab also. And then we are into now working with the government, doing surveillance, doing rapid test, antibodies test into the community.
Dr. Mansoor Ahmed, are you happy with the state of help which poor people in Pakistan have available when it comes to the pandemic?
Well, of course, I mean, to begin with, I think even under the normal circumstances, the healthcare infrastructure, it barely, I think, resembles what we have over here. I think the amount of the percentage of the GDP which we spend on the healthcare, the situation in the hospitals, the lack of insurance, lack of medication. You know that, I think in the district hospitals, it's a chaos. I think even under the normal circumstances.
Yeah.
So now you basically throw in the pandemic. Even the richest country in the world, the United States of America, we have nothing but the chaos in New York. We are talking about $2.2 trillion healthcare system. We are basically supposed to be the iconic model and all that. And the chaos, I think, which you saw basically in New York, I think that gives the model what not to do and how not to handle the pandemic. And now in Pakistan, I think to begin with, we have a lack of resources, lack of the money, the population overload, and rest of the problem. And now you are dealing with the pandemic, which even the richest countries, I think, from Italy to Spain to France, I think you look at that, and the whole effort. I think one has to clearly understand what we are trying to accomplish over here. We are not basically, I think, our strategy, this flattening of the curve concept, which everybody knows. It's not about to decrease the number of infection. It is to decrease how many patients will get infected in a given time. So we are just trying to, by all these measures of social isolation or whatever you have, putting the lockdown, the idea over here is to spread the rate of the infection over the longer period of time. So you don't get too many sick people in a short time. If you get one 100,000 people got sick in a 6 weeks period of time. Small percentage of that basically will end up in exhausting the existing infrastructure. So the idea is over here is, and this is the epidemic, this is the natural history of the epidemic, and particularly with the coronavirus, that invariably over the period of time, in the absence of the vaccine, majority of the patients will end up in getting the infection. All we are trying to do with all these measures is to decrease the flatten the curve and all that, so people get infected over the longer period of time. It doesn't overwhelm the system, and it sort of then raises I think the major issue, the principle of treating the COVID pandemic. Nobody have the answer. You have the different models right now. One is the Sweden model, where they do not have any lockdown. They basically kept the economy open, and they essentially adopted certain things which people can do, that such as social distancing and wearing the mask and protecting the most vulnerable, the elderly, and they let the young people basically come out to the workforce. And still, they're trying to basically mitigate the infection by those common sense things, the hand washing, I call the personal hygiene, wearing the mask, and social distancing, without putting the entire lockdown of the society. And so that's one model running. And we are just watching to what happens now. What is the complete lockdown model, which you have in Singapore, which you have in South Korea. And so that's one thing. Second, I think that the issue which we as a society in Pakistan, that we have to look at that one. Yes, the South Korea model and Hong Kong, Singapore model is an ideal, but you can't have the ideal model in a country like Pakistan, where you have overpopulation, where you have basically it's large percentage of the people are living in the poverty. They cannot afford to lose one day job. What exactly the overall strategies? Keep in mind, that this virus is most likely will end up in what we call the endemic virus, just like other coronavirus, which they never disappear. So this virus will stay there. Even with the vaccine, it may stay for a long time, just like other coronavirus. So it means that down the line that we are whether by default or by design entering into what we call the herd immunity, where most of the population basically get infected, and then eventually, when a lot of people get infected, the virus doesn't have other people to infect, and the rate of spread in the epidemic basically sort of a way become like a
So,
nuisance rather than the
so
epidemic.
let me ask
So
Dr.
that
Khan.
said, I think
Yeah, go ahead.
that's my basically, I think that the
Okay,
issue which need to be debated in Pakistan.
sure. Dr. Khan,
So Barisha, thank you so much. I think it is an honor to see you.
Thank
Dr.
you.
Khan, do
Thank you,
you
Mr.
feel that there are, poor people in Pakistan are more affected by this thing? Because another hypothesis people have presented is that Pakistanis have immunity, which is higher than immunity to Americans have, and that's why there are less level of casualties.
I don't buy that concept because many of the people die of simple malaria, simple uh, tuberculosis. If our immunity had been so strong, then we would have been be dying for simple these diseases. So that I do not buy it. But it is the poor people initially. It was they were the well-off people who were getting the disease because it was brought by the well-off people because the well-off people travel outside the country, so they brought it in, and they were it was we had most of the patients were in Defense and Clifton, so those came from abroad. Then it went into the community. Now it is into the community, and but I must appreciate the efforts of the state, the federal government, and the provincial government, especially the Sindh government. They have come up with very differently, and they have done it. They have opened their funds for this diseases. They've also established all about 90-95% test PCR done in province of Sindh and other Pakistan also. It's totally state funded. 95%.
One of the things what you just
So
said, it started out in the richer communities and in high society because they have
yes,
capacity to travel. They brought in,
yeah.
but now it is getting into the
Now it
community.
is in the community. It is in
Which
the
means it
community.
is going to be at a more dangerous state now because these poorer communities are living close by and it
Yes,
may spread faster.
yes, it is. Now that's how we I told you that now we are getting triple figures now. Last year, the last 24 hours, it was more than 2,000. So for last 1 week, it has been 1,500, 1,700, 1,800, 2,000. So we expect that it will increase dramatically. And that's why we are worried about this, that we will be overwhelmed. Our healthcare system will be overwhelmed by this numbers coming
So
in
what are the
thousands.
preparation if the system is overwhelmed? Here in New York, where system uh, they were afraid will be overwhelmed, so they have this naval hospitals and they turned in open space areas into extra bed facilities, which were not quite used, but they were preparing for a larger number of victims and to treat them. So is Pakistan preparing
Yes,
area?
yes. Yes, we initially what we did was basically to develop isolation centers, basically because the poor people, when it went into the community, we can have richer people isolated at home because they have separate rooms. But for poor people, because in two-room houses there are 10 or 15 people, and the laborers, the factory workers, we have about 8 or 10 people in one room. So we we established about 1,200 bedded isolation center in Expo Center, where these people who couldn't be isolated at home were brought there. And now we initially they used to stay there for 2 weeks or 3 weeks, but after last 10 days, we have changed the advisory. Now, after 10 days of positive, asymptomatic positive patients can be sent home without doing a test, doing a confirmatory test PCR. So now we have isolation centers. Now, what we need, we have enough ICUs, but what we lack and are the HDUs because there are people who doesn't need ICUs, but they need IDUs because uh, they are desaturated. What they need is oxygen, and then we are increasing the capacity of all those things. So hopefully the health department is working hard. The private sector is working hard. Now the government have engaged had an MOU with private hospitals because to use their facilities in case the poor people they cannot afford, and the government is going to pay for that. So the 5 or 6 private hospitals there is MOU with private hospitals also, but they are coming up with other HDUs also. But we hope and we pray that the influx should be less than what the efflux is. So we are keeping our finger crossed. We are praying to Allah Subhanahu wa Taala that we may not enter into a state where the healthcare is become fragile and becomes broken.
Thank you. We will continue our conversation. You're watching Muslim Network Television, and you can always watch us on Galaxy 19 satellite and Amazon Fire TV, as well as our own website, muslimnetwork.tv. This is Malik Mujahid hosting Mujahid Talks, and we'll be right back after these messages. Welcome back to Mujahid Talks at Muslim Network Television. We're talking with Dr. Abdul Bari Khan, who is a cardiac surgeon in Pakistan and a well accomplished, highly awarded surgeon in Pakistan, and Dr. Mansoor Ahmed, who is also from Pakistan but currently in Cleveland, Ohio. One of the things which the world was scrambling was that how to get hold of test kits.
Mhm.
Does Pakistan have enough test kits?
Initially, there were some problems. Now we do have it, but it's a basically global pandemic, and every country is worried about their own citizens. So the logistics are because there is a total lockdown, the flights are closed. So the problem, the DHL Express, which used to deliver and deliver the goods in 24 to 48 hours. Now it takes the same DHL Express takes about 12 to 14 days to deliver the goods, and the cargo flights are also banned. So there are problems. The major problems are basically the N95 masks, but from the crisis you have opportunities also. So we initially where we were very short of the PPEs. Now the factories are we are manufacturing all PPs in Pakistan, rather than now they're thinking of exporting it. So we are manufacturing now the masks. Uh, some N95 masks have been developed in Pakistan. So the majority of the things are now being manufactured in Pakistan. But
That's very
we do have,
interesting. So
but
personal
we do have a
protective
problem.
equipment, which is in
Yes.
short supply in United States still. You're saying that Pakistan is self-sufficient and producing its own protective equipment?
Yes, yes, everything, the face shields, the Tyvek suits, the gloves, the mask basically, the surgical mask. So I heard in USA, one of my colleagues was in California. He said we've been asked to make our masks, paper masks from their home and come and use that in the hospital. So,
Mhm.
so because your system was overwhelmed, but fortunately we were not. But now people are there. Majority of things are. We are at Indus Hospital, so we have almost now made a ventilator ourselves, which will be hopefully the prototype is ready and which has been tested, and hopefully by next week it will be ready. And
How many
and with
ventilators Pakistan has at this moment?
At this moment, we have about 4,000 across Pakistan, but the need is much more than that. But fortunately, as we don't have so much sick patients, because at Karachi we have about 130 ventilators, and we have about 46 patients on ventilators. So we have about 30% patients are on ventilators. We have vacant, almost 60%, 70% ventilators are vacant, which can be used.
Mhm.
So in Italy, using the technology of 3D printing, some people invented a method in which one ventilator could be used for 2 or 3 patients. Are you familiar with this technology, or is it being?
Yes, yes, we are, but there has some issues with that. So we have not reached to that extent that we will be using one ventilator for 3 people. As I told you that we have about 60% ventilator is still vacant to be used by the patient. So it basically when the time it may not happen, it shouldn't be happen. We pray that it should not be, should not go into that area, that uh, place where we have to use all ventilators are occupied and we have to use this technology.
Mhm.
So the ventilator, which is invented by or re-engineered in Pakistan, do you think that will be available for mass production? Because there are a lot of countries who are short in very short supply. I mean, US is minding its business, and there seems to be some national competition in which one vaccine producer in Germany was being lured by America, and the European Union came in giving $86 billion to keep him over there. So it seems that at the era of pandemic, a sort of a nationalistic competition is rising as compared to a
Mhm.
cooperative system in which people, even in America, I interviewed a professor and his team. He has invented vaccines in the past successfully, and he has a vaccine sitting in his refrigerator. But federal government, gave $3 million when he invented that, and now he has no money to test it out because he is not connected with the commercial interest. He just want to invent it and just give it to people in different countries so it could be manufactured at a larger scale. So a mix of capitalism and nationalism is limiting the cooperation at this moment. Do you think the people who are inventing these things in Pakistan are open towards the idea of sharing these things at a broader level in the world?
Yes, I suppose basically it will take some time to reach to that extent, but we are uh, our system, the model which we have, it is open to all. They can use it. We don't want to make it a business. And what we have achieved is, I think so, the ventilator which we will be ready by hopefully next 10-15 days. It will be costing, because I gave them the target that I should have this ventilator within. There would be two type of ventilator, one basic model and one advanced model. And basic model to be within $200, and the advanced model within $1,000, and they have achieved it. So hopefully, and they have got the best parts from across the world, and which I think so by next 10 days it will be up and about, and it can be used. Now it can be replicated, and whoever wants to have it, we can give it to them.
You might be interested in this thing, and there is a Pakistani American who was involved in getting the guiding directions on GPS as a chief scientific officer of NEFTEC. He used to be one of our hosts. He's going to start hopefully pretty soon our science show. He has invented a ventilator in the US, and his prototype in US costed $6,000. And would you be interested in getting in touch with him, so his know-how and your know-how, and maybe something good will come out of it?
Definitely, we would love to, and I think so. We know the Pakistani living expat, Pakistani living in US, they love their country much more than us who are living here. So it would be a great. I think so. This collaboration will take us a long way, coming up with something which will the world will benefit from it.
Yeah, my main concern is that there are Pakistan, mashallah, is the fifth largest population, young population, innovative people. I remember my uncle taking me to on a roadside, and he asked me, "This bus which you see, how old do you think this bus is?" So the bus looks pretty good and nice, and so I said maybe 5-6 years old because it's pretty shiny and everything. He says no, it is 60-year-old bus. Not a single part of that bus is actually original, because Pakistanis in different streets are sitting there. Every part has been replicated. So structure may be fancy. Inside part, there's nothing original except the basic metal of the thing. So with that innovativeness, there are other countries who are way smaller,
Yes.
way lower in GDP, and have no other countries who are willing to help them. And in competition with America and China, America is worried about itself, essentially because of our president's style and policies of America first has become sort of America limited to I don't know what. And China has provided help to about 150 countries in the world. But China also is a sort of a totalitarian regime, who combine totalitarianism, communism, and a worse form of capitalism. So people who are motivated by philanthropy like yourself, may God bless you and may God increase the work which you do. They have interest. So I'm very amazed that you gave this challenge for people to produce a small device within couple of $100, and a major one a little higher than that, and people were able to reproduce. So I think if the motives are right, as Prophet Muhammad, peace be upon him, says that everything depends upon what your motives are, right? That's
Yes.
the first saying of Prophet Muhammad, peace be upon him, when you open the any book of hadith. إِنَّمَا الْأَعْمَالُ بِالنِّيَّاتِ. So
Yeah.
the motive is to help people, as Indus Hospital chain is established. Tell me this, Dr. Mansoor Ahmad, as Pakistani American leader and a physician, how you and your team can help the amazing work being done in Pakistan.
Yes. First of all, I think Dr. Bari, mashallah, we know him for such a long time, and he's actually the pioneer. I think nobody has, mashallah, accomplished what he has done. I visited his hospital, I think one of the toughest day in Karachi, and the Karachi was locked down, and I went to his hospital. The first EMR that he has it over there, I think the first EMR, we didn't have the EMR at that time in the United States. Then he has the program with connected with the Harvard Public Health School, if I remember, I
Yeah.
think, where you were
Yes.
in this seminar on the public health. And the third thing was that this was the only organization which got the grant from the Bill Gates Foundation on the TB. They were doing the surveillance program and TB and all that. So,
Yes.
mashallah, God bless you. I think it is an honor to know you, Mr. Qayyum, who passed away, was our common link.
Yeah. Well,
So that said, I think that there's a tremendous reservoir of people that who really, as you know very well, that they are trying to help Pakistan in any shape, form, or capacity. The telemedicine, giving them the input,
yes.
ICU case management, for example. I try to reach out to Sania Nistar 3-4 times before this thing started. That this is probably one of the, I think, defining moments. If we come out of this crisis alive, I think I'm very, very worried about the magnitude that it has wrecked the economy, even in the United States. Within 16 days, I think it collapsed in front of us on its knees. And then what we can offer to them is specifically, I think the telemedicine. I think we have a system in place. We definitely for the cases where you need basically not outpatient cases, because most of them they will get better. ICU management, for example, for these cases.
Well, Dr. Mansoor Ahmad, let me challenge you. I mean, you're a community leader, and I love you. You know that, and we work on many areas. Can Pakistani physicians in America challenge the Pakistani manufacturers and industrialists who are motivated by philanthropy, whom I'm sure are the donors of Indus hospitals? I was sitting among my relatives, and I asked who, after visiting the Indus hospital and seeing that beautiful sign, call this number if somebody asks you for money. I asked them who funds, and they looked towards each other and remained silent. Later on, my brother-in-law told me all of our zakat goes in that direction. They are industrial family. So can Pakistani Americans, physicians in America, can give this challenge to Pakistan when this thing which is being invented is a low-cost ventilator? If somebody is getting into manufacturing and providing it at a low-cost level to Pakistan as well as the other countries, assuming, because Dr. Mansoor, you yourself said that this thing might continue. This thing might, it has just started penetrating the poor people, which are congested communities. So God forbid, we should pray, but we should prepare for the worst situation. Do you think you can take up the challenge of supporting those industrialists and manufacturers in Pakistan to take this ventilator and scale it production-wise?
I think that it is required. Yes, the answer is that we can certainly try. I think there are many venues to do that. I think we have a business council, as you very well know, here in the United States, the Pakistani business people. We have APNA, I think, and then we have. But I think it is very difficult to work with the government sector because so much of bureaucracy goes over there. I think the Indus presence of Indus and Bari leadership, and that it gives the opportunity, I think, to work with the private enterprise, for profit, not for profit, and to bring some of the resources in a very focused fashion. If the focus is to look at these ventilators, I think I just like to know that I'm very, very heartened to know that the simple ventilators, I think can be manufactured, which can be manufactured because
not only that, Dr. Mansoor, but a hospital and Dr. Abdul Bari Khan getting involved in the system of challenging people to produce. You see, our nation need to be challenged. Okay, this is the problem. That's how it need to be solved. I think innovation comes from that, not one but many. But we need to conclude the show. I would like to have
Just to add, Malik sir,
from Dr. Abdul Bari, your last thought. You have a minute, and I'll give you a minute, Dr. Mansoor, as well.
just to add one more example. Initially, we had some problems with the shortage of VTMs and the swaps. So now we have developed our own VTM. Now we have developed our own swap. I came across a Pakistani industrialist when I went to his factory, and he was manufacturing the parts and the consumables for Metronics. So the things were going from Pakistan to US, and we were buying from Metronics, which is 100 rupees, and we are paying about 1,000 rupees to that, just getting the same. And the factory is about 1.5 kilometer from Indus Hospital. So we said, no, we can have this. So with them, we developed a swap, VTM, and it just costs 100 rupees with 2 tubes and all this, and we were buying for about 500 rupees or 600 rupees. So now we'll have
your hospital is situated in industrial area. Maybe you should visit each factory to figure out what they can do.
We will, inshallah. This will become an endowment for Indus Hospital.
Inshallah. Dr. Mansoor, last thought. You have half a minute left.
Well, first of all, I think we thank you so much for your vision, Mujahid Saab, if bringing this such an important topic from physician perspective to a discussion, and bringing, I think, one of the best, what we have in Pakistan, Dr. Bari, and the idea basically over here is that by working with individual leader like that, we can make some difference, maybe not the entire difference. And I think we are open for giving any help. I think creating a COVID task force here in the United States, bring the diaspora of Pakistan over here, including the APNA, and provide them the resources, intellectual or material, to what they are doing over there. I like the program. We like the concept, what you're doing. I think
Thank you. Thank you so much, Dr. Mansoor. Yeah. I'm tremendously thankful to Pakistani Physicians Society of Chicago for connecting us with Dr. Abdul Bari of the Indus Hospital. And thank you so much. And thank you, Dr. Mansoor Ahmed. You're watching Mujahid Talks at Muslim Network TV. You can always watch us on satellite, Galaxy 19, throughout USA, Canada, and Mexico, as well as Amazon Fire TV and our own website, muslimnetwork.tv. Thank you so much. We're there 24/7. There is programming for children, programming for grown-up, programming for families, and you will enjoy, and you would love to be part of it. Thank you so much. Assalamu alaikum. Peace be with you. Be safe. Be healthy.
Thank you. Thank you.
Thank you. Jazakallah.
Jazakallah.